Today on Substance Stories, we're going to be talking about GHB, the dangers of using it, and how to get help. Today I'm going to talk to you about GHB. Now, GHB, gamma hydroxybutyrate, it's been around for a long time. It was actually discovered in Russia in the 19th century, so it's in the 1800s, but it wasn't really used medically until the mid-20th century when the guy Henri Laborie, a French surgeon who was the same surgeon who actually discovered chlorpromazine, which was the first antipsychotic he ever discovered. So Henri Laborie, he worked out that you could use it as an anesthetic. And so it started being used medically that way. And then in the 80s, bodybuilders worked out that you could use it to stimulate the release of human growth hormone. So it started getting used illicitly by bodybuilders. And then following that, other people worked out that it was highly sedative and it really stops the sort of, it really messes with our ability to form memory. So it started to be used as a date rape drug. Nowadays, GHB is used quite commonly in the sort of chemsex scene. And also sometimes you see GBL, which is a prodrug of GHB, essentially means it's got a much longer half-life, used as a sort of sedative drug. How does GHB work? Well, GHB works on GABA receptors. So that's the that's the brain's main inhibitory neurotransmitter. It's the same neurotransmitter that alcohol, benzodiazepines, baclofen, barbiturates, they all work on the exact same neurotransmitter, which is GABA. What GABA does is it slows us down, makes us uncoordinated, makes us sleepy. The careful thing about GHB is that it's got a very, very steep dose response curve. So that means that a little bit of GHB gets me quite sedated, and just a little bit more and I'm a lot more sedated. So it's very, very easy to overdose on GHB because of this. So it makes it very dangerous. We call that having a steep dose response curve, because the dose and the response is very steep. So it's very, very, very risky drug to use, especially if you mix it with other drugs, which people often do. So if I mix GHB with another sedative like alcohol, it is very easy for me to end up dying from an overdose. So it's a really, really tricky drug. So having said that, we really need to keep in mind when we're using GHB, if we're using GHB, that we need to be really careful about mixing it with other drugs, because it's a really easy way to die. The other thing is be really careful when measuring it, and really, really careful. You want to start low, go slow, because you don't want to overdose on it. So it's a really, really dangerous drug. It's really not a drug I would ever recommend anyone ever messing with. The other thing that obviously you really got to keep in mind, it's sort of a harm minimization thing with GHB, is it's a clear liquid. And there's been some awful cases of people leaving it, in sort of water bottles around in the reach of children or other people that don't know it's GHB, and they have a sip of GHB could absolutely end up with you being in the hospital. So if it's not clearly labeled as GHB and you leave that, anyone, a child or an adult, can easily end up overdosing. The other thing to mention about GHB is, by a country mile, it's got the most dangerous withdrawal. So people that are addicted to GHB that go to hospital for withdrawal routinely end up in ICU, and this is even with immediate treatment. So people that are coming in for planned GHB withdrawal and are getting high dose benzodiazepines and high dose baclofens, this is absolute cutting edge treatment of it. Still, the number that end up in ICU is well above 1%. It's probably about 5%. That is with cutting edge treatment. So the ability to die from a GHB withdrawal is really, really high. This is a very, very serious drug that really don't want to mess with. That withdrawal period starts because it's a short acting drug, that withdrawal period, your withdrawal can start within 30 minutes and withdrawal can go on for 21 days, and really, really complex withdrawal. How people die from GHB withdrawal is for two ways, same way that people die from alcohol withdrawals: seizures and this thing called delirium, which is essentially when our brain is inflamed, we see things that aren't there, we get very, very confused. So getting treatment from GHB withdrawal, if you are addicted to GHB, this is not something you can deal with on your own. You need to get treatment for it. You need to be reaching out for help immediately, because this is not something you can ever just cold turkey off. This is cold turkey and will absolutely result in terrible outcome. If you are struggling with GHB addiction, definitely reach out for help. Unfortunately, there's no medication that's proven to help people with GHB use disorder. So it's really something that you need to engage with, services like Narcotics Anonymous, drug and alcohol counseling, and absolutely an addiction specialist to get yourself into a hospital to safely come off it. Hopefully this has been a good information session about what GHB is and how to get help for it.